Hi, everyone. Welcome back to our live Q&A on Crushing Doubt every Monday, 6 p.m. Eastern, 3 p.m. Pacific. Really great to see many of you back in the chat already with some questions. So we're going to get right to it. This is questions about mind-body issues. And our first one comes from Mike P. He's a return viewer and, of course, somebody I've worked with before. So, Mike, thank you for coming back. I always love your questions. Let's read it aloud. I had a question about better adapting the belief of full recovery. Since I've eliminated most doubt that my body is broken, I've noticed tiny, small improvements as of late. Is the idea that once doubt in body structure is reduced, this leads to reduction in pain, which leads to a strong belief in full recovery? Like reducing one doubt helps to tackle the other. Is that the long and short of it? As usual, Mike, you've hit the nail on the head. Your incisive way of thinking really does capture a particular thing that a lot of people experience. And that is they need a little bit of proof to be able to come a step further. And it's a big part of how my system works. One of the reasons that I work with the columns in the way that I do is it's how I had to work also. I started reading Sarno and I was like, listen, I'll believe it if anything changes. But it was when something changed at all that I became quite convinced something's up here. The only thing that changed was something about the way that I was thinking. And now I'm getting a bodily experience of change. Those little changes can be incredibly helpful in building confidence. So when we talk about crushing doubt, it's not usually that you go from lots of doubts to no doubts at all. It's just like you said, we go from lots of doubts to less doubts, or I don't doubt that now. And once you get one step, it makes it a lot easier to believe what's coming next. So I really couldn't have said it better myself, Mike. The answer essentially is yes. That is the long and short of it. Perfect answer. Perfect question. The answer was fine. The question was great. Let's go to another question. Oh, Mike P has another thing. Does that make sense? Like, in order to believe you can recover, you probably need to see some evidence in pain reduction first. And if that happens from reducing doubt in a bad back, then great. Absolutely, yes. Again, I didn't realize you were summing up that. So now we're going to get a question from Tony Smith. Welcome, Tony. I know we've interacted some on the message boards of some of the shows. And it's great to see you here. This is the first time I'm seeing you here. Oh, by the way, I should say, anybody who wants to come on the show, last week we had our first guest come on video. You can come on video or audio. It's www.callcrushingdoubt.org. And that will be a way that you can get set up in a room. They'll let you know what to expect and then bring you on. So if you want to, please do. Tony's question. Can the symptom imperative feel like an acute injury to another part of the body, even though there was no trauma in the new part? Now, she has a second part of the question, which I'm going to read. For example, you've made enormous progress on your back pain, then knee pain pops up. You guys are asking fantastic questions, and you're so right on about the questions that the answer is yes. I don't have to say much else. The answer is yes, but I will get into more specifics about it, Tony. One of the things I love in the way that you phrase it is you're capturing something that a lot of people are going to need to know. The symptom imperative means that you get rid of one symptom and another symptom then pops up. In the mind-body process, that's part of how it works because the function of a needed symptom is still there. You still have fears or you still have the emotional thing going on. So the body and mind moves on to a different part of the body. But the important part you're capturing, which is going to be so important for so many people, is that it feels like an acute injury. It does not feel like, oh yeah, now the pain shifted from my back to my knee. It feels like I had back pain and now I have knee pain. It's a sudden shift. And a lot of times it waits for a what I call a trigger, some kind of event. Let's say you're playing basketball and you push off on that knee and then it hurts. Or let's say you're shoveling snow and you were, using force on that knee, boom. And it can happen in a very acute way, like you're saying, Tony. I think this is what you're asking, where it could feel like there really was an injury there. I did something to myself. So the answer is not only yes, but usually yes. Usually the mind wants it to be a convincing symptom. And so it's going to make you think there was another acute injury. So I hope that answers the question, but follow up if need be. For those of you who are new here or haven't done so, please remember to click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. I will respond to them. I think people have seen that I make sure to respond to every single one of those comments. You are a valuable part of the community, and I want that to be valued. Now, we have a couple of preloaded questions. This is also something that happens. If you can't attend the Q&A, but you want a question answered, you can send me an email. You can send it to dan@crushingdoubt.org and let me know that you want to have a question included. So we have a question from Linda, and it is, how can I access trauma that I internalized as a very young child if the memory is just emotional and visual, but may have happened when I was pre-verbal? Fantastic question. I love that we capture different things out of different questions, but let me first explain what pre-verbal means. People can probably get the basic gist of it. It means before you could speak. But the reason that it's important to think about from a psychological perspective is, what does that mean for that kid? It's not just that you couldn't speak and things were happening. It's that your brain was processing all of it. And if you were processing all of it but couldn't speak, you're more likely to have symptoms from that time. So a lot of symptom work does come from times that we don't even remember. And that's essentially what I think Linda is asking. How can I access that if I was so young that I don't even have a memory of it? And it's just emotional and visual. So my answer to that is, take the body at its word. You actually don't need to remember what happened. Your body's telling you how it felt. With these symptoms, the body is telling us what happened to us, essentially. So the long and short of this answer is, you don't need to access the trauma. You're already accessing it. Your body is telling you exactly what this was like. Now, you can use that information to maybe learn more about, what does that mean specifically for me, or how did I feel about it? You can learn things from it. But don't worry about trying to access it, because you already have it. The body's telling you what you need to know. We may need follow-up from that from you, Linda. If you're watching this later, put it in the comments and I can, answer more. Or maybe somebody else who's watching has a response to that and wants to say more about it. Ask me questions about it. Happy to talk about it, but I thought it was very important to highlight. So when you sent me that question, I was all too happy to bring it on. Now we have a question from Kim Herwick. Kim, hi. She's another person who has been working with me, and we've been making some really good, steady progress. So she says, let's see if we can get this loaded up. I will start reading and it'll pop up on the screen in a second. Why does anxiety pop up as a symptom imperative? I didn't know that was going on, and the anxiety continued to get worse and worse to where it was running my life. I think she meant ruining my life. Yep. Now that I know what is going on, I'm able to handle it much better. Found that breathing through the episodes helps so much. My legs turn to jello when anxiety hits me. Thank you for this observation, Kim. It's a very important one. And as we know, we've seen it in our work together. Most people don't tend to talk about anxiety as a mind-body symptom. But if you're having the kind of anxiety that comes up in your body, it is a mind-body symptom. So yes, you could be anxious in thought, thinking, "Oh, I've got this test, I'm worried about it." That's not a mind-body anxiety so much. A mind-body anxiety is more like, I feel a tightness in my chest and my heart's beating fast, or I'm sweating, or I just can kind of feel, I just feel icky in some way. That's the other thing, is anxiety can present in so many different physical ways that it's hard to track. But the important observation that Kim is making, which I do think will help a lot of people to think about it this way, is to think about anxiety as an equivalent of a physical symptom. So you might find, and this fits with Tony's question, you might find that you had back pain. It actually fits with Mike's question too. You might find that you had back pain, and then you start to get better, and then a symptom pops up. And let's say it's knee pain. And then the knee pain gets better, and then anxiety happens. What Kim is highlighting is, if she didn't know that that was one of the symptoms that could come up in addition to these other things, she wouldn't know to look for it. She wouldn't know how to recognize it, and she wouldn't know that she can treat it the same way that she treats the rest of mind-body issues. When she came to that revelation, that was when that symptom started to get more under control. And recently we had some fun laughing at the way the mind-body process was working, because you start to feel more and more in control when you can recognize it and then it moves. It's like, I'm going to try to fool you this way and try to fool you this way. But Kim finally was able to laugh at her symptoms because she wasn't worried they were going to be stuck there anymore. And I think that the anxiety piece was incredibly key for that, because when it finds something to hide in and you don't know that it's a symptom, it's got you where it wants you and it's just going to stay there. And I think that's what was happening with Kim. We do have another preloaded question. So let's bring that one up from Rick. That should be up any second now. And actually, I have another preloaded question that I'll bring up if there's time. We'll see. Do we have that question from Rick yet? I'm not. Here it is. Good. Rick says, Dan, as I understand it, I'm supposed to focus on my symptoms. This seems to go against everything I've read about TMS. Remember, TMS is tension myositis syndrome. That's what Sarno called a mind-body process. It came to be generalized, and now there's other terms for it, but I'm just remembering to translate, especially for new people here. Aren't I supposed to ignore my symptoms? Okay, so Rick also, when he brought this question to me, it was actually on Twitter. You can follow me on Twitter. In fact, my Twitter handle's right there, right below. But Rick asked me a question on Twitter, and it was about somatic experiencing. So I'm going to explain what somatic experiencing is. And if we can leave this question up, because I'm going to need to get back to it shortly. Somatic experiencing is when you pay a lot of attention to your symptoms and you retrain your mind to recognize that you are safe. So essentially, you let yourself have whatever symptoms you're having, but you redirect the mind away from a sense of danger to a sense of safety. Now, I am not trained in somatic experiencing, so I'm not claiming to be an expert on that. But when Rick asked me the question about it, I understood what he meant. Now let's get back to his question. Many people in the TMS or mind-body world will tell you that you really are supposed to not pay much attention to your symptoms. We had Dan Buglio on the show. He's a great mind-body coach, and he's got a lot of fantastic ideas, and he's helped a lot of people not pay attention to their symptoms. And that is fantastic. So Rick's asking, well, if I'm supposed to not pay attention to the symptoms, how come some people are saying, let's do somatic experiencing, pay attention to the symptoms, and then learn to re-experience them in a new way? So I'm going to give you first the short, unsatisfying answer, and then I'm going to give you the long, more satisfying answer. The short, unsatisfying answer is that people are so different in their minds that not everything's going to apply to everyone else. And even worse, people are so different from who they are at one point and in one part of their life to another that they could have differences in how they need to handle a particular symptom at one time and in another. So in other words, you vary from yourself and you vary from everyone else. But here's the long answer, which is much more satisfying, I think. There are rules that you can figure out when does which apply for you. So if you can get a sense that your mind-body issue really is a lot about attentional issues, then you might not want to go into somatic experiencing, because that's just going to get you deeper in. It's the same thing that we talked about. I can't remember when I said it because I talk about these things a lot, but journaling helps some people a lot. And journaling does not help other people at certain times. And it depends on how we conceptualize the mind-body experience and what's happening. With journaling, if it's an emotional experience, journaling does tend to help people, especially people who are not that aware of their feelings or don't have them honed so well. Journaling can be fantastic for that. For people who have been to 20 years of therapy and they've gone over and over and over it, they might actually start to get really irritated about it, and then it doesn't help. Well, the same thing is true with attention. Some people have attentional issues, and some people, it's not really about that. For some people, it's an emotion issue. For some people, it's a doubt issue. For some people, it's a power issue. One of the reasons that I find my work can be helpful to people is it's multifaceted in how it understands the mind-body conundrum that you're having. And I work with people to get very specific about what what's happening in your mind-body experience, because you have your own mind. So, Rick, the answer is it depends on your mind. And it also depends on your mind at certain times. There could be times where you do need to reinterpret the symptoms in a somatic experiencing sort of way and get a sense that you're not in danger. And then there could be other times where you got to stop thinking about it. And it's variable, but you can learn the rules of you and you can learn the rules of mind body experience. I say this a lot, but I do have these PDFs that are available for a relatively low fee, and they have a lot of ideas in them about how to distinguish what's an emotions problem, what's a doubt problem, what's a power problem, and what are some action steps you can do about it. So feel free to contact me if that would be helpful. Again, the email is dan@crushingdoubt.org. I seem to be having a somatic symptom. Happens almost like half of the broadcasts that I do have some kind of symptom like that. And just by observing it, it's gone. I mean, I did clear my throat also, in fairness. All right. We are going to get to another question from Tony. On a recent podcast, you mentioned that diagnosis was not as critical as addressing symptoms. Can TMS manifest as ADHD, similar to anxiety or depression? Wow. Many times you guys ask questions and I reserve the right to think about them a little bit. So, Tony, I'm going to give you my answer, but if I need to come back to it, I'm going to do that. It's not just an instinct, though. I will say that, yes, I think that TMS can manifest as ADHD, similar to anxiety or depression. Here's the thing. If your body can do it for one thing, it can do it for a mind-body reason. So essentially, you've got all the systems in the mind and body. I mean, let's think about what ADHD is. It's a very complicated experience, and it can be very multifaceted, just as anxiety can be or depression. But let's take just an example. And one thing about ADHD that is often misunderstood is it doesn't really mean that you can't pay attention. Usually it means your mind races to many, many different things. I just had a patient talking to me about this today because she's starting to realize she thinks that's what she has. And I don't disagree with her, but I also think there can be a mind-body component and a trauma-based component to have your mind racing that much. So yes, ADHD, all of those things, concentration issues, foggy brain, a tendency to have your attention wander somewhere else, to not be able to focus on one thing, to have sensitivity to experience. These are all ADHD symptoms. I tend to think of ADHD as, like Tony's asking, not something that I would necessarily focus on the diagnosis of first. I would more focus on it as a symptom in relation to TMS and how it manifests. So, Tony, let me know if I answered your question well enough there. I'm happy to follow up. We have a question from Matt Anderson, who was our first live guest last week. And just to remind the viewers out there, one of the reasons he came on is that he's been working on power and he wanted to feel powerful. So he came on as the first guest to let himself be powerful. I think that's great. So let's pull up the question. I think he's got two questions. So let's pull up the first. I'm going to start in on it. What's your take on leaky gut or microbiome imbalances contributing to pain? Seems like gut health is a major buzzword now. That's absolutely true, that gut health is a major buzzword. And the interesting thing, and let's leave this up for a sec too, because I want to say a couple things before I come back to the question. One of the interesting things about gut health that I've come to understand is that the gut is the part of your body that has the second most neurons in your body, and it's not even close. So that means the brain, of course, has the most neurons anywhere in the body, and the second most neurons in the entire body is your gut. So what people have started to understand is that the gut is almost like a second brain. When people say use your gut or think with your gut, that's not an accident. You actually can think with that gut. Now, it's not thinking in the same way that you do with the brain, so you can't be like, gut, what should I do about this? It's not going to tell you that. It gives you kind of more blunt, not as clear ideas about things. But there's a lot of thinking happening in the gut, and as a result, there's a lot of symptoms that come out of the gut. There's also a lot of hormones in the gut, like serotonin exists in the gut in large quantities in a way that it does similar to the brain. This is part of how they figured out that it's almost like a second brain. So the question is, what's my take on leaky gut or microbiome imbalances? Matt, I assume that you would include in that things like celiac disease or Crohn's disease. These are things that I might need to tease out individually, but I would say overall, there's a lot of diagnosis going on about gut conditions that are TMS driven, mind body driven. Now, let me remind you guys of something. It may be mind body driven, but we have to remember mind body things start in the head and they become real in the body. So these things that are happening in the gut could really be happening. So, we also, I have to say this too. Doctors talk about these terms like everybody knows what they are a lot of the time, and most people don't. But here's another problem. Doctors also talk about terms and they mean different things. You're going to have 2 doctors or 3 doctors or 4 doctors talking together using the same terms, and they don't even mean the same thing. Same thing happens in psychology. You could be talking to somebody and they say, "Oh, he's a narcissist." And then you're like, "Oh, okay, what do you mean?" And then they describe it and you're like, "No, that's a sociopath. That's not a narcissist." So it can get very confusing, these different terms. And as I always say, if you're not sure, I would say to go to a doctor, but not because I want you to doubt that it's a mind-body condition, because actually going to a doctor will help you doubt it less in one of 2 ways. Either they will give you the all clear, and then you know that you can focus on a mind-body issue, or they'll give you a diagnosis that is one of these diagnoses that isn't very clear. A doctor's good diagnosis is clear and it makes perfect sense. There's not randomness to it. And leaky gut is one of these ones that alarm bells go off for me, generally speaking, about it. I'm not saying I'm not open to the fact that maybe there's something going on there, but almost always it is a mind-body process. Now, Matt has a follow-up question to that. Do you feel it's more of a marketing ploy from CAM doctors? I'm trying to think what you mean by that. CAM. Can you tell me what that abbreviation is? It's funny because I often feel like, oh, I should know this. I'm a mind-body expert. I should know all of these things. And I probably should, but I don't. So tell me what that is. Do you feel it's more of a marketing ploy from CAM doctors that are indicating your body is full of toxins causing inflammatory response? I, for one, no longer believe it, but curious of your thoughts. Okay, Matt, I want to clarify something and make sure I'm answering your question correctly. So let me know if I'm not. What I was reading you to mean is that you no longer believe that the body is full of toxins causing an inflammatory response, but you're curious about my thoughts nonetheless. Now here's a question. Oh, alternative medicine, CAM. Okay, thank you. Thank you for clarifying. Sorry, I was being dense. So is it a marketing ploy? Complementary alternative medicine. Okay, that's what CAM is. Thank you, Matt. I appreciate it. Is it a marketing ploy? I would bet there are people who, yes, get into marketing ploys. I just found out, this was totally shocking to me, but shocking, but not shocking, which is that on the bottom of plastic containers, you know how they have those recycling signs? Well, as it turns out, that was a complete marketing ploy. There is no recycling of plastic. That all was to get people to feel better about buying plastic. So unfortunately, we do have parts of society that are willing to engage in marketing ploys, things to sell certain things that they know are either not good for us or don't do as much as they say. So is it a marketing ploy? I don't know. Are they misguided in that notion? Yes, that I can say for sure. I think that there's a lot of misinformation out there. I think frequently people are giving the misinformation and actually believe what they're saying, as opposed to, having some kind of marketing ploy or that sort of thing. So I did want to remind everybody, if you haven't already, click subscribe and ring the bell for notifications, but also hit like if you like what you're hearing. That's how I know that you like the information you're getting, and that's how I can kind of direct, what I should say more of. If I get a video where there's tons and tons of likes, I'm a quick study. I figure out what you like, and what you need. So finishing up on Matt's question, I think mostly it's not a marketing ploy to start. I think it's a belief system that is faulty, and then marketing ploys follow. I'm not an expert on marketing, but that's my answer about that. And I think these are great questions because they bring up the idea that we do need to be a little wary of certain diagnoses. I'll say one last thought on it. When doctors give a good diagnosis, there's usually a good treatment that works. When doctors have no treatments that work, you have to wonder if they have the right diagnosis. As it turns out, this is what back pain, the process that back pain went through in society is they were not getting good solutions at all. And somehow we kept giving them the credibility because they're doctors and they were the best thing we had. And they may have even been doing the best job that they could, but in the end, they were not getting a treatment that was working. And that was a sign of a bad diagnosis. Whereas when we start to work with mind body stuff, and it does start to work little by little, as Mike P's question showed, the proof is in the pudding. The treatment should actually work. That doesn't mean it's always going to be working at a given moment, but we're seeing overall it works. We have a question or a comment, I think, actually, from Kim Harwick. She's talking about somatic tracking again. She wasn't the one who brought up somatic tracking, but she's bringing it up again. Somatic tracking made me feel worse. Too much attention to your symptoms. I think that's a very good observation, Kim, and I think it's an important one to keep in mind. You need to take stock of what is working for you. My action steps are generally ways of thinking. They're not even things to do, though I think of a shift in the way you think as an action. That's a very important distinction. But somatic tracking would be something that could work for some people, but is not going to work for a lot of people. And the reason it doesn't work for a lot of people is just what Kim said. You were already attending to the symptoms too much. A lot of pain sufferers will echo this kind of statement. But when I had 8 years of back pain, the very first thought I had in my mind when I woke up was, how's my back? And the very last thought I had before I fell asleep, generally, was something along the lines of, what's going on with my back? Am I okay? And there were thousands of times in between when I had my mind on my back. I did have a question recently from another person I'm working with where he was saying, okay, but how am I supposed to get my mind off of the pain when, I'm having all of this pain? So that's a totally legit question. And I think it's not very fair to ask of the sufferer, oh, just don't pay attention to it without there being some kind of change. So I think the information is very key. You got to get new information. I like to think I'm bringing new information to people. Some of it relates to, other people you may have heard from, Nicole Sachs or Dan Buglio or Howard Schubiner, or Eric Sherman, John Strack. So many of these people have brought up important information. David Schechter's another, but I feel like I'm giving an Oscar speech now. So if I leave somebody out, I apologize. But there's a lot of good information out there. But it is true that I bring different information that I got from myself. So this is getting back to that question about somatic tracking. You have to start to collect the things that work for you. Your mind works in a particular way, and there's nothing wrong with you. There's nothing wrong with how you work. The key is to, in a non-judgmental way, just assess, how do I work? What do I need? What's not working for me? What is? I was working with another woman, and then we're going to get to, I see a question from Ted Turner, who I assume this is not the Ted Turner. I don't mean any insult by that, Ted Turner. You are our Ted Turner, for sure. But, I think when people are working with their specific minds, they have to be able to accept, all right, who am I? What do I need? And I was working with a woman recently who, it really was very attentional. Every time we started talking about emotions, she'd hit a roadblock. She couldn't get there. Every time we started talking about strategies, she'd get worse. And when she got confidence, then she could let go of attending to it. So I think somatic tracking works for some people. For a lot of people, it's not the way to go. Go the other way. Let's get to Ted's question. Is it true if you don't use it, you lose it. All right, Ted, I'm going to have to make an interpretation of the question. And if I don't get it right, please do some follow-up with me to let me know if I'm getting at the right idea. But I think what you're talking about is essentially, does atrophy cause problems? I don't know if you're asking if it causes pain or just problems in general, but you may also be asking if you don't use your mental process, does that go? So this is the problem with asking a psychologist a question like that. There's so many ways that I can read it. I will answer you, but if I didn't answer the question that you were actually asking, please get back to me. I want to be of use to you. So I'll say this. Is it true if you don't use it, you lose it? From a physical standpoint, yes, the body will atrophy if you're not using something, but it recovers very quickly. If you start, I mean, let's say you could get to a point where you had not been working out at all, and maybe you do it for about 2 weeks, and you're back. You're back almost all the way. I mean, maybe you're not going to go play, in an NBA basketball game that way, but for being a normal functioning human being, you don't need to be using things so much of the time. Now, this is especially important when we're talking about things like arguments about core muscle strength causing back pain. That's an argument that people use all the time, and they say, if you're not using it, you lose it. And so now people are working out feverishly. Well, the fact is, cavemen weren't going around doing exercise routines. They were just doing their thing. And we also do our thing. And people can argue, oh, you sit in chairs too much. But I mean, there's nothing else to do in caves. I can guarantee you cavemen were sitting around a lot, probably more than we are. So I don't think it's true from just a general use standpoint that if you're not using it, you lose it. Now, with respect to the mind, you do need to practice certain things. In some ways, if you get to a certain point, like I play guitar, I don't need to practice very often to hold on to that skill because it's really nicely cemented. So if we're working on getting symptom relief and how we're thinking about things from a mental standpoint, at the beginning, yes, you want to keep using it. So Ted, I'm giving you like 100 different ways to interpret your question. I'm sorry about that, but hopefully I got that right. If I didn't, please follow up with me. Next question is from Rhonda Johnson. I have heard a lot in the TMS community about the importance of teaching your brain and or nervous system that you are safe. Could you please share your thoughts on this idea? Oh, great question. There's so much in this. So, this is we actually have had a question from Rhonda before, but this is her first time being on live. So, thanks for coming, Rhonda, and hello. Good to see you. There's so many things in this question. So, this is another one to leave up on the screen. I'm going to need to answer some things and then get to the question. So, the importance of teaching your brain and or nervous system that you are safe is something that we want to be working towards. But here's the thing. This is where doubt comes in. If you don't have any doubt, you won't need to teach your brain that you're safe. You will feel safe. And that's part of the difference of how I work and why doubt is so important. Before you get to that point, it's like what Mike P was saying, you want some incremental gains. Maybe you want to feel a little safer. In that way, yes, let's teach the brain and the nervous system that you're safe. But I will say this also. People talk about neural pathways. And neural pathways are a real thing, absolutely. It makes sense. When the brain is firing in certain regions, it gets used to doing that. And those neural pathways will be there. But I don't believe that neural pathways get stuck there or grooved where you're going to have a big, hard time changing it. That does not add up with the evidence that we see scientifically. It doesn't add up with what I know logically, because we hear all of these stories about symptom reduction that happen fast. And if that's not you, that's okay. We can still use that information. Those symptoms didn't resolve fast because they somehow were able to overcome very grooved neural pathways. No, that's not the case. What happens is the brain is extremely adaptive and it will change fast. So the bottom line is to feel safe, we need to get at the heart of why you don't feel safe. And I'm not talking in a therapy sort of way because that takes years. What helps much more Not that therapy is bad. Of course, you're not going to get a psychologist telling you therapy is bad. But if you can take your mind at its word, your body at its word, then you can get a lot more information about what is making you feel unsafe. So it's incredibly important to feel safe to get the symptoms under control. But the way to do that is for you to actually know that you are safe. And that usually takes getting at the heart of the matter. The body's the one that does that for us. I hope that answers the question, Rhonda, but let me know. Another question from Tony. Thanks for all these questions, guys. It really makes for a lively, good discussion, and people learn a lot more. So I'm going to keep it rolling along because we're getting great questions. There are so many messages that pain comes with age. This brings up doubt that at 56, I can overcome TMS. We are taught you just have to accept the pain. Can you comment on this? Fantastic questions. I love the variety of the questions too. So here's what I'd say, Tony. I want to start with the second half of the question first, and then we'll get to the beginning. So let's leave this one up on the screen also. The idea that you're taught to just have to accept the pain is something that people who don't have the right information are giving you. What they're actually saying, and I hate to be kind of blunt about this towards them, but what they're saying is, if I can't help you, you'll have to accept the pain. That's a total cop-out. I would say that if your treatment's not working for everybody, maybe you're not the person who needs to be treating these people. Or maybe the medicine you're bringing or the ideas you're bringing aren't working. And let's talk to people who are having success. I'm one of them, so I'm happy to tell you about it. And not only am I one of them, but my system makes sense scientifically and logically. So this is important. So the bottom line is, you absolutely do not have to accept your pain. That would be going against what the pain's actually there for. The pain is a communication between you and yourself about what you need to feel safe and good in the world. I know it doesn't feel like that because it's horrible. It seems like it's the enemy. But actually, when we look at it from the right angle, it ends up being that it is sending you a message that you need to receive. Now let's deal with the first half of the question. You're having doubt that at 56 you can overcome TMS. And I absolutely understand that. I had doubt on the opposite side of the perspective, which was, if I'm having pain at age 29, how would I ever get better? I had it when I was young. 28 actually was when it started. So, Tony, there's many ways to resolve that doubt. And I could come at it from a bunch of different angles. I'm going to give you a couple, and then we'll follow up as needed if you don't, if you have more questions or you feel like you still need more. One of the things that I would say about aging that maybe could help with your doubt is that if aging made pain worse, then essentially what we would see is a total linear experience of age and pain. And that would mean that 90-year-olds would be in the most pain of anybody, except for 100-year-olds. It would be that we would get worse and worse and worse and worse. Now, I understand we have stories of that happening, but that's for a different reason. I'll tell you what gets worse with age: fear. Fear gets worse with age a lot of the time because it's scary. Mortality is scary. We have a sense that our bodies are diminishing, and they are in purely physical ways, but it's not something that correlates with pain. What we see all the time, and doctors will actually validate this too if they're being honest in any way, is that the vast majority of pain, as Sarno called it, is during the responsibility years, ages, let's say 30 to 75. This is when you are dealing with getting married, having children, all the stuff of jobs. People do tend to get symptoms when they retire, but there's actually a lot less symptoms in retirees than there are in these people who are working jobs all the time. So the age thing doesn't actually correlate. There's also a study by Ellen Langer, who was a sociologist, I believe, at Harvard, and she did a study on a bunch of 79-year-olds, 79 to 81-year-olds, actually, and they pretended that they were in 1959, and their vitals all got better over a 5-year period. Now, it didn't stay that way, but this shows you that symptoms can change fast. So that's another way that I would use to conquer some doubt about this, Tony. But yes, we do get tons of messages. And one of the things we need to realize to get better from TMS is we have to recognize that society actually doesn't understand this very well at all. We have to be very choosy about who we're going to trust with this information. There's tons more I need to say about that, Tony, so I'm not even sure I did it total justice, but you can overcome this pain. There's no reason that you can't. There's also, you know, the fact that we can understand that mind-body principles are really causing the pain. And if you can see that, you don't have to just fight against doubt about society. You get definitive proof in yourself that you can believe. Lots more to say about that, but let's follow up with questions. We've got a question from Susan W. Do you conquer it? Do you conquer it? What are we referring to, Susan? Let's see if I can look back. Oh, do you conquer the pain? I'm not sure what your question is, but I'm going to answer what I think your question is. You do conquer the pain. If you conquer the doubt, you conquer the pain. And you can't fake it. So you got to get your questions answered. You got to get your confusion, under control. You have to have reasons to not be afraid. It's like I said, you can't just be safe. You have to understand what the problem was and how you can feel safe. It's my job to explain it in ways that make sense. So keep the questions coming, and I'll keep at it. Thank you, Tony. You're saying it was a very helpful answer. I'm glad to hear it. That's fantastic. But do ask more as needed. We're going to get to 2 more questions, and then we may run out of time. So if you have other questions, I can bump it to the next Q&A, or you can send it to dan@crushingdoubt.org, and I will, or put it in the comments. All of these are ways that I, Susan says her first comment didn't take. So get back to us. Maybe we can get in 3 questions. We have a question from Paula Saslow. In TMS, is the pain always a result of a sensitized nervous system, or is this only a subset of pain that can occur? Fantastic question. I would say it's a subset of pain that can occur, Paula. And by the way, there's people who have come on who I do know or don't know. And if you do know me and you want me to acknowledge it, please let me know, because they're confidential meetings. So if I don't acknowledge you and I do know you, it's no slight. It's just, I'm protecting your identity in case you want that. And that was not in reference to Paula, by the way. You can't guess who I've seen. Ha ha. So it is a subset of pain that can occur, but I would say a sensitized nervous system is a little bit of a misnomer. I don't think that people have a sensitized nervous system so much as their nervous system is revved up by specific events. What I like to tell people to think of instead is your body is a flowing emotion. You go through many different physiological experiences and many different physiologies every day. So don't think of it as you have a sensitized nervous system and you can't get past it, even though that's only a subset of pain that can occur, because there can also be trigger pain, there can be doubt pain, there can be pain from a particular emotional experience. There's lots of different ones. And Paula, I'm not doing that justice because we're running low on time. I'm going to try to get to these questions as fast as I can, and then we might need to do follow-up in the comments or on emails or next week. We have a question from Karen Isaacs, another return person, and anybody who's watched the channel may know she was in one of our testimonial videos. She was nice enough to come on. She has a comment, not a question, about last question regarding age. She's 59 and feels better than she did in her 40s. She overcame backaches. I no longer feel stiff. My husband is 63 and still plays hardball. He's a catcher. That's a hard position to do. So Karen, thank you for lending that. It's obviously anecdotal, but it does help people to know that we have experience with this. If age caused pain, it would do it in everybody, not just in you. All right. Amy C., can you speak to identifying emotional themes when pain flares up? And guys, I do want to acknowledge I'm going to have to stop shortly. We unfortunately have a hard stop tonight, so I'm going to need to stop somewhat abruptly. Just a heads up. Can you speak to identifying emotional themes when pain flares up? I can't seem to pinpoint any particular emotion when my symptoms flare. Okay, so yes, Amy, I would say let's talk on the side about this, or I can revisit this next week. If we don't interact this week, I will bring this up as one of the first questions in the next Q&A. But briefly, I will say I have a whole system for identifying emotions that maybe you wouldn't have thought to do. It's a particular way of thinking about emotions that takes broad, high stakes themes, but makes it very specific. There's a lot more I need to say about that, and I'm not doing it justice. We are going to have to stop for tonight. So I see, Susan, I see your question, and I wish that we had time to take it. I hate saying no to anybody. What I'm going to do is either follow up with me, on the side, or we can answer the question in the comments, or I will save it for next time, but I will get your question answered. So everybody, I want to thank you for joining me. These questions were great. If you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below. This was another great crowd, and we're getting lots of great questions out there that are helpful for people to hear the answers and hear the questions. Thank you so much for joining me again.